Hi, Dr. Trudy. Hi, Dr. Marcus. How are you today?
Good, thanks. How are you?
I'm good, thank you. So this morning I came across a patient who hasn't been to the dentist for several years because he was worried and very anxious about coming to the dentist. Finally, he made it to the office today because there was a tooth that has been hurting him for several months. Unfortunately, the tooth couldn't be saved at the end. Have you ever come across any patients like that?
Yeah, certainly. I have seen a lot of patients who are scared or being nervous or even anxious going to see the dentist, so it's quite common.
So dental anxiety seems to be very common, isn't it?
Yeah, dental anxiety or dental phobia, it's where patients have had a very bad experience in the past and then that has led them to avoid coming into the dentist. And this can cause a lot of problems when they don't come in for a hole or they don't look after the gum disease, then they can lose teeth and it can cause infections and a lot of problems.
I see.
So it's good to, if we can allow patients who are anxious to be more comfortable and get their teeth sorted, so then they'll have really nice healthy teeth.
Definitely. So how do you feel about coming to the dentist yourself, and how was your dental experience in the past?
Well, I've been quite lucky. The dentist I used to see when I was a child, he is really, really gentle, so I never developed that phobia or anxiety to see the dentist.
How about you, Dr. Marcus?
Yeah, so personally, I have a fear of needles and pain, and so there's been some times when I'm like gripping onto the chair tight, or sometimes where I've actually, a long time ago, I was close to like passing out a few times, but I've found that I've been able to become less anxious of needles over time.
So what strategies have you used to help your patient overcome these fears?
But I think it's really important to find out exactly what they're afraid of, and so find out what's happened in the past, what's caused a lot of this anxiety, and try and make it more comfortable for them.
For the people who are worried about the cost, we are quite transparent with the finance part of the treatment. We always tell patients upfront how much the treatment is going to cost before we carry it out, so there's no surprise when they come to paying for the treatment at the end of the day. And with the patients who are scared of the sounds, we tell them that they can wear their earplugs or even their headphones listening to their own music so they can be more relaxed during the treatment.
And I usually explain to the patient every single step along the way. Let's say I'm about to give you injection now, we're going to start drilling now, so patients know what to expect, and I always give them the options of stopping me whenever they feel like. They can always put up their hand and I'll stop. I realize that even as dentists, we are somewhat afraid of coming to the dentist ourselves, and we have our own fears.
I do have some anxieties, and I know that there's a lot of patients out there who have dental phobia and anxiety, and it can seem like moving mountains to come in and have dental treatment. But I think it's really important to take things like one step at a time. And the first step might just be giving us a call, having a chat, or it might be booking in for an appointment just to have a chat and to have a checkup just to count the teeth, and then to be explained the whole process and look at ways to try and reduce your fear and your anxiety. And then you can be more comfortable and you can look after your teeth, and then it'll be much easier to keep your teeth and have a nice smile.
It's good that we're sharing those tips with each other today so that we can make the experience at Maidstone Dental for our patients more enjoyable in the future.